Let's bring in Dr. Vin Gupta, pulmonologist and global health policy expert, and an MSNBC medical contributor, and Natasha Taylor, Deputy Director of Consumer Advocacy Group Georgia Watch. Dr. Gupta, if those ACA subsidies aren't extended, what happens? What are doctors' biggest concerns for patients?
Absolutely, Anna. Good morning. There's going to be a few. So we know many will go without insurance. They're just going to make the decision because of these doubling or more than doubling in their premiums that they will just not go sign up for insurance. We also know that many will shift to high deductible health plans and become underinsured, meaning that their annual deductible has to be met, in some cases, thousands of dollars before insurance really kicks in. For your viewers out there, if you spend more than 5%, if your deductible is more than 5% of your annual income, that is considered underinsured. From a clinical standpoint, what does that actually mean for patients? That means more patients coming in, skipping their insulin if they're diabetic and diabetic crisis. We're entering cold and flu season, Anna. This is not the time to have a delayed diagnosis of flu. We already know about 20 to 30% of the country ends up getting delayed diagnosis of flu, and you need that Tamiflu within the first 48 to 72 hours to be most effective. So I worry about delayed diagnosis, delayed treatment, but then that shift from either to loss of insurance or to underinsurance and what that means about what people will skip.
So, Natasha, I know your organization has been speaking to people who are already struggling to make ends meet right now. What are you hearing from folks about healthcare costs? Just how crucial are these subsidies?
We're hearing families telling us that they're going to have to start making tough decisions between paying their rent or paying for healthcare coverage. I mean, as it was just pointed out, with those premiums set to double, triple, in some cases quadruple, that's not affordable for most families. It's really unfair. It's an unfair position to put them in.
Dr. Gupta, President Trump floated this idea over the weekend of sending money currently going to insurance companies directly to individuals who are buying health insurance instead. What do you think of that idea? Is that solution a realistic one at all?
It isn't because, ultimately there's only the pot of money that people will actually see from a family standpoint is still pretty small relative to their potential needs. So we worry about catastrophic healthcare insurance. Something unfortunate happens or unexpected, that's not going to be even close to covering what somebody will need to cover an ER visit, ambulance if they, God forbid, they needed that, or an inpatient stay. So it's something that might seem like it's actually useful, but when you think about how much healthcare costs, especially inpatient healthcare costs, that doesn't begin to address that issue.
It still feels like these subsidies are really just a Band-Aid for, the healthcare costs increases we keep seeing year after year. And yet, what is the alternative? Natasha, we have Republican Senator James Lankford of Oklahoma this weekend making these comments when it comes to Obamacare and the efforts that Republicans have had and been working toward for years, and that is repealing Obamacare. Listen to this.
Is the Republican proposal not to repeal Obamacare, which has been the long-held position?
Yeah, right now, Obamacare is health care in America. What Democrats did 15 years ago was they radically changed all health care in America. They moved all physicians under hospitals. They changed all the reimbursement programs. They shifted everything in. So it is health care in America. So the challenge is what we have now has to be fixed.
That seems to be a long way from repeal and replace. What are your thoughts about what we just heard?
Well, in Georgia, we appreciate the support of both Georgia senators to extend these tax credits and keep Georgians covered. Healthcare should not be unaffordable for anybody. And you're already having high rates of medical debt for people as is. I just think it should be a key priority for both parties to make sure that healthcare is affordable. The cost of living is going up for rent, mortgage, groceries. Healthcare should be the last thing that continues to increase in coverage.
Dr. Gupta, can I just ask maybe the most basic question? Why is health insurance so expensive?
Well, right now, what we're seeing is insurance companies, and this is including even government payers, Medicare, Medicaid, they're dealing with increased costs. I mean, I think we have to recognize it, and that's because of drug costs. There's a lot more people that are wanting access or covered access to the weight loss drugs. That's a separate conversation. We're trying to see downward pressure there. hospitals are all struggling for a variety of reasons. And so the cost to actually, for them to square their hospital costs, they're increasing prices for hospital stays. So the pressure here is, how do we keep people out of the hospital, get them basic access to primary care? I take exception to what the senator just said. Obamacare 14 years ago, or 10 years ago, did not fundamentally change the doctor-patient relationship or how doctors operate within the healthcare system. It gave coverage to 24 million Americans who did not have access to healthcare. It didn't change anything more broadly about Medicare. It didn't change anything about self-employed insurance programs that represent 50% of adults. So that was a misstatement.
All right, Dr. Vin Gupta, always can count on you to give us those good fact checks. Thank you for that. Natasha Taylor, thank you. Appreciate you both. Now, before we go, in a report last hour on federal gambling charges in Major League Sports, we intended to show a photo of former NBA player Damon Jones, who has pleaded not guilty in that probe. Instead, we showed a photo of former NBA player Damian Jones, who is not involved in the investigation. We regret the error. That's going to do it for us today. Thank you so much for being with me. I'll see you back here tomorrow. For now, I'm Ana Cabrera reporting from New York. Chris Jansing picks up our coverage next.